Allina Health, we believe healthcare is more than just treating people when they are sick. As a not-for-profit health system, we are also committed to improving community health and helping people live healthier lives.
I think our future really is in healthcare, thinking about health from a community perspective. We're very active in athletics, in healthy eating, in school health. This is a way for us to connect. And there's a lot of studies that show if you're connected to your community, you're more healthy. What we're trying to accomplish is a pattern of long-term health, where we get to them before they're sick. And that's really what this is all about.
So, what happens when Allina Health connects with the community? Volunteers unite. 64,810 hours of time was volunteered with more than 500 nonprofit organizations.
My name is Tulsi Sukhdeo. I'm a physical therapist with Sister Kenny Sports and Physical Therapy. I volunteer with Boulder Options. We try to recruit mentors to just impact a young child's life in kind of a positive way. I think it's a way for me to show my appreciation for all those people in my life that have gone out of their way of taking that extra step to assist and guide me along the way.
Partnerships develop. Thousands more people are reached through community partnerships. Partnering allows Allina Health to build on the strengths and expertise of other organizations and have a greater impact on health.
Sheridan's story is based on partnerships, and without partnerships with Allina Health and other organizations, our mission of fighting child hunger would be extremely difficult and potentially impossible. Having the partnerships with the community organizations, is what allows us to function and to serve the hungry kids in our community.
Communities engage. 3.8 million people were reached through community health education efforts, and thousands participated in prevention and wellness programs and activities.
Currently at Allina Health, we have a lot of initiatives going on with the community. We have the Neighborhood Health Connection, the Healthy Communities Partnership, the Heart of New Ulm Project, as well as the Backyard Initiative, that all get into the communities where people live and have the communities help tell us how we can help them live a healthier life.
The community connection itself is part of health, and while access to healthcare services is one piece of health, it's just a piece. It's a community coming together, it's caring for each other, it's caring about who's next to you, and even people you haven't met yet.
So we have started to see some success. Part of what we're looking for is getting people more engaged in their health and well-being. So we're starting to see kids get outside and move more frequently. We're seeing people eat more fruits and vegetables. And more importantly, we're having people start talking about health and how this impacts their daily lives.
Kids get active. Allina Health partnered with Free Bikes for Kids to give over 5,000 bikes, helmets, and bike safety education materials to low-income and underserved kids throughout our service area. Money is raised and good causes get a boost. Employees gave nearly $900,000 through the Employee Giving Campaign to support community programs, and Allina Health gave over $1.2 million in charitable contributions to community organizations. Students learn. More than 5,500 students participated in School Health Connection.
We've done a lot of research on the benefits of health and wellness and how it directly impacts students' learning. Things like exercising before a test, movement throughout the school day has had a huge positive impact on student achievement. The impact of this program, starting early at such a young age with the focus on health and wellness, it's teaching kids those habits of healthy eating, exercising, and it will have a lifelong impact.
I loved it.
Learning that pop have a lot of sugar in it.
Water is good for you because it has no sugar.
You can't eat bad food.
Lives are saved. In 2012, through the Heart Safe Communities program, 98 automated external defibrillators were placed in communities and more than 4,000 people were trained in CPR and AED use. Since the program began, 55 lives have been saved. Global Neighbors Benefit. 130 Allina Health employees volunteered in 24 countries around the world.
My name is Brian Prokash. I work with a plastic surgery program that does plastic and reconstructive surgery, and we work out of Lima, Peru. For the past 30 years, our program's been going down to Lima and repairing cleft lips, cleft palates, and also burn scar contractures. Serving the community, serving the world in some way is a wonderful thing.
People get screened. 9,278 individuals were screened during 378 events for high blood pressure, obesity, heart disease, stroke, peripheral vascular disease, and/or diabetes.
Well, I found out that I had interrupted aorta type A, and this was a life-threatening thing. Not a lot of people will survive this, and I ended up having to go get surgery, and it was really extensive. It's scary. It was a long recovery, but it worked out. If I hadn't done that screening, I don't know what would have happened. I just want to thank Allina Health so much. I'm very grateful. You know, I'm just really happy to be here, and I just encourage them to keep doing what they're doing.
So, what happens when Allina Health connects with the community? Health improves.